Today, we're tackling something that's way more than just textbook knowledge or medical charts. We're talking about professional communication for nurses.
So let's think about this for a second. Imagine you're this incredibly skilled, experienced nurse. Your medical knowledge is absolutely top tier. But what happens when all that expertise just isn't enough to build trust with a patient or to really click with your colleagues? That's the puzzle we're going to unpack today.
And it's such a frustrating spot to be in, isn't it? You could have a perfect command of the language, know all the right words, and yet something just gets lost in translation. The connection isn't there. So what's going on? Well, the answer has almost nothing to do with grammar and everything to do with something much, much deeper. So that leads us right into our first big topic, the communication barrier. We're going to take a look at the hidden challenges that so many brilliant, internationally educated health professionals run into when they step into a brand new healthcare system.
And that's where some really smart programs are stepping in, like the one at Kwantlen Polytechnic University in Canada. They saw this critical gap and created specialized programs to help bridge it for what they call internationally educated nurses, or IENs.
And really, what their whole program is built on gets right to the core of the problem. They realized that the issue isn't about knowing the words. It's about cracking the code of all those unwritten rules, the cultural cues, and the subtle expectations that define professional interactions in a new place.
So if just learning the language isn't the whole solution, then what is? Let's jump into the next section and see how this program totally rethinks how you learn to communicate.
They're using this really cool model called performance-based learning. And listen, this is not about sitting in a classroom taking notes. It's all about action. It's a cycle where you learn by actually doing the thing, getting coached in real time, performing in simulated scenarios, and then getting instant feedback.
Honestly, the perfect way to think about it is like a communication flight simulator. It gives you a safe space to practice those really tricky, high-stakes conversations. You can try things out, you can even mess up, but without any real-world consequences. It's all about honing your skills before you're in the pilot seat with a real patient.
But, every pilot needs a flight plan, and this training provides exactly that. A super clear, structured blueprint to help you navigate those patient interactions with confidence.
Well, that blueprint is something called the Calgary-Cambridge Guides. And don't worry, this isn't some super rigid script you have to memorize. Think of it more as a proven, evidence-based roadmap. It gives you a structure for a consultation that's designed, step by step, to build rapport and trust from the second you walk in the door.
So, what does this actually look like in practice? Well, the guides break everything down into 6 clear stages, kind of like a journey. First, you initiate the session to create that initial connection. Then you gather information, making sure you're really hearing the patient's side of the story. After that, you provide structure, so the whole visit feels logical and not chaotic. You actively build the relationship, explain the plan, and make decisions together, and finally, you close the session so everyone knows exactly what's next. It's not a checklist, it's a flow that makes the whole interaction feel safer and clearer for everyone.
And what's amazing is that this big framework is really built on all these tiny, specific actions. They call them micro skills. We're talking about stuff like active listening, a simple nod or an I see, or just pausing to give someone a moment to think, or signposting, where you say, okay, now we're going to talk about these little things. They make a huge difference.
Okay, so you know the theory, but how do you actually get good at this stuff? This is where that performance-based model really kicks in. It all boils down to this really powerful dynamic cycle: practice, film, and feedback. This learning cycle is incredibly smart and thorough. It all starts with awareness. That's where you learn the theory. Then you move into coaching and rehearsal, practicing those little micro skills with an instructor giving you pointers. After that comes the performance, a filmed, timed role play with an actor playing a patient. And then, and this is the most critical part, reflection and goal setting. You watch the video back, you get feedback, and you pinpoint exactly what you want to work on next time. It's this amazing loop of constant improvement.
It all starts with the why. Before you can do anything, you have to get it. This is where you absorb the framework, learning the actual evidence and theory behind what makes communication click, not just what makes it sound polite.
Then you take that knowledge and put it into action. This is the practice field. You get to try out those new phrases, really test your active listening skills, and see how the concepts work in a safe, simulated setting, all without the pressure of a real clinical outcome.
And this is where it all comes together, perfecting your approach. By watching those film sessions and by getting that super specific expert feedback, you get into this rhythm of constant refinement. It's how you find your blind spots and turn communication that's just good into communication that's truly great, and eventually second nature.
But here's the thing. This isn't just about talking to patients. These skills are the absolute key to navigating the entire workplace culture you find in Canadian healthcare.
I mean, just think about something as simple as a greeting. The cultural norms can be worlds apart. In some places, using a formal title like Nurse Jane or Mrs. Amelia is the ultimate sign of respect. But in Canada, it's often more informal. Using a first name plus a firm handshake and direct eye contact is the standard. These are those little unwritten rules that can make or break rapport in an instant.
And this training builds a whole toolkit of these essential soft skills. We're talking about how to give and receive feedback in a helpful way, how to disagree with someone professionally, or even how to speak up in a team meeting. Knowing how and when to interrupt to ask for help, that's a huge one. These aren't just nice-to-haves. They are the skills that make a nurse an assertive, respected, and effective part of the team.
So when you boil it all down, what we're really talking about is the idea that great communication isn't just something you're born with. It's a skill, and it's a skill that's deeply connected to culture and context. It's not just about the words you say, but how you say them and how you make people feel. Which kind of leaves us with one last question to chew on. What are the unwritten rules of communication where you work?